Mr. Neng.
Mr. Deputy Speaker, it is timely that Singapore is going to shift away from illness-based hospital care to a more sustainable way of patient-centered preventive care. This is a good move, but there will be challenges during the implementation stage. The general practitioner of GPs are critical to the success of Healthier SG. After the release of Healthier SG white paper, I managed to communicate with a few GPs, including the GPs that are practicing the Nanyang divisions. In general, the GPs are very supportive of the Healthier SG. While some GPs operate in residential areas and are clearly family clinics, others practice in the workplace, and those GPs that practice in the workplace are concerned that some residents or many residents will not appoint them as a primary family doctor, especially those residents above 60 years old who are not working. So how would MOS address this perceived inequality? On the other hand, some popular GPs may be overwhelmed if too many patients want them to be their primary family doctors and they have to turn people away. Minister Ong alluded this in his opening speech. For Singaporeans, securing a family doctor should not be a competition. As such, I would like to ask, what is the maximum number of patients each family doctor can accept? What is the set criteria which doctors can use to decide whether to accept or reject assisting a new patient under the Healthier SG? For instance, will they take into account into factors like whether the patient has visited the clinic before, or how far away the patient lives from the clinic, or on a first-come, first-served basis? What exactly are the factors that we have to take into account, and is that a priority? Meanwhile, one GP, who is the only doctor running his own clinic, has requested me to ask if it is compulsory for all family doctors to join the primary care networks or PCN. Such GP also has questioned on the need to be qualified as a family physician. Referring to page 42 of the Healthier SG white paper, it states that each GP clinic must have at least one family doctor to be registered as a family physician within 7 years of the launch of Healthier SG. Thus, I would like to ask, does it mean that for the family clinic with only one doctor, and the sole doctors have to be qualified as the family physicians? If so, this may have profound implications for family clinics run by solo doctors. If GPs are to oversee the end-to-end journey of caring for a patient, it would be helpful if they work with partners to deliver this care. According to the article from the Harvard Medical School, such GPs, or we also call them primary care physicians, work in teams to keep patients at the center of all diagnostics and treatment activities. These teams often comprise of medical assistants, nurses, pharmacists, and social workers. Likewise, in Netherlands, where the GPs is the central figures in the Dutch primary care, GPs employ salaried nurses and primary care psychologists who can even provide mental health services. The typical practice size is approximately about 2,200 patients per full-time working GP, and over 95% of the citizens are registered with one GP that they have chosen. Chronic care management is coordinated through care groups, which are mostly GP networks. These care groups coordinate care from multiple services providers for certain chronic diseases such as diabetes and cardiovascular conditions. Would MOH envisage the formation of such GP networks in Singapore? If so, will such networks be coordinated by the respective 3 health clusters? Outside of the clinic, there are many touch points and community engagement opportunity with the members of the public. I heard from Mr. Masagov that the healthcare cluster will coordinate with the community partners and GPs to provide healthy activities for the residents. And to this end, as a member of Parliament taking care of Nanyang Division of the West Coast GRC, I'll be happy to leverage on my community partners to work with the healthcare clusters and the GPs in Nanyang to provide healthy lifestyle activities for the residents. As with any change, it will take time for the residents to embrace healthier FG. Preventive care requires more commitment from people to live more healthily, commit to advice from their doctors, and spend time on regular health screenings. Many Nanyang residents I met and have spoken after the release of the Healthy SG white paper are very supportive of the Healthy SG, but they also raise some concern. And let me continue in Mandarin. 许多的南洋居民都非常支持健康 SG， 但也是有些疑问。那我举一个例子来说明一下。60多岁的陈女士，她从年轻的时候就在她家附近的张诊所去看病。她刚换了工作，张诊所不在公司指定的诊所名单内，所以陈女士不能把张诊所看病的费用向公司索取医药费。陈女士听到健康 SG 的时候就很高兴。他很想指定他所熟悉的张医生为他的固定医生，也享有免费的打疫苗针的福利，同时索取三高的药丸的时候，也有享有很高的津贴。但是当他有伤风感冒的时候，他知道他还是需要到公司所指定的诊所看病。这样的情况就如白皮书第24页所说的那样，如果陈女士有选择的话，他还是希望凡事有病的时候，就到他熟悉的张诊所。就如健康 SG 所建议的，但是这样的矛盾，我们希望卫生部能够解决。健康 SG 另外一个重点在于鼓励国人多参与有益身心的活动，就如跳 Zumba dance、Zumba 舞，或者是到公园快步走，或者是参与园艺活动等等。到目前为止，这些活动大多数对妇女来说比较有吸引力。但是对男士来说就不太一样了，很多男士宁可愿意在咖啡店里喝酒，吃配酒的菜，聊天，聊到天长地久。看来我们需要一个全国总动员，为男士们量身定做，吸引他们从酒桌转到乒乓桌上，从吃韭菜转到种青菜。这虽然不是卫生部的强项。但是健康 SG 这是不可缺的重要因素。我希望部长花点心思来酌量一下，并预算多一点的资金投入在这一块。Next, I would like to touch on another very important topic, which is the funding. Minister Ong has indicated that it will cost about 1 billion over the next 3-4 years for IT support and the other one-off costs to bring the GPs on board the Healthy FG. At the same time, the recurring cost of running FDSG will amount to 400 million a year, including the service fee for the GPs. As mentioned earlier, the healthy activities for the residents as coordinated by the respective health clusters are a very important component of the healthy FG. So I would like to ask Minister Ong how much of the 400 million budget will be allocated to organizing healthy activities and nudging residents to engage in such activities. And earlier I heard from the SBS Rahayu, they will make Healthy SG 365 as a very key component of the entire Healthy SG. But we know that there are many other apps that are very popular with the residents. For example, is the Nomi Health. So how would the Healthy 365 interface with those apps that's very popular right now, like Nomi 365, like Nomi Health, so that they can be more coordinated and benefit more residents? Ultimately, we can take inspiration from what is being done in other countries for preventing healthcare. A research study of primary care physicians in 10 countries, including Australia, Norway, United Kingdom, and Switzerland, show patients that are managed by one primary care physician are able to view information about their medical records and even email to the doctors. Well, this could prove quite onerous for our GPs, but it will certainly go a long way in building trust between the patients and the doctors. In conclusion, I would like to quote an advice by Dr. Chung Wei Peng, an elected member of the Singapore Medical Council and a very popular GP in the Nanyang division. Dr. Chung said, people want to live a fuller life rather than a longer life. People want to live a fuller life rather than a longer life. Currently, Singaporeans' life expectancy is close to 85 years, but they spend more than 10 years in ill health. With healthier FG, we hope to reduce the number of years spent in ill health. This is possible if all Singaporeans, all GP, all government officials, and all community partners are ready to make healthier FG as a priority for better Singapore. I support the motion. Thank you.